we continue going inside the biotech business, and in this moment I want to thank those who are with us here at Baluarte and those who are via live streaming. Thank you for being with us. And we continue learning about venture capital. In this moment, Alberto Sanz is going to moderate this panel. Alberto is Director of Financing and Investor Relations of ISEX Invest in Spain, and he will introduce the experts. Thank you, all of you.
Thank you very much. It's a pleasure being here. Thank you very much to Acebio and to the partners and of this Biospain Congress, and to, of course, the city of Pamplona and Navarra for hosting us. Good morning to all of you. It's a pleasure being here physically, finally. And we have today a very interesting panel about venture capital. It's like a continuation of the previous panel we just had. And we have 4 excellent panelists for this morning. We have 3 physically here and 1 online. Let me introduce them to you, and they will shortly introduce them too. On my left, I have Raúl Martín. He's partnered at Isios Capital Partners. Good morning, Raúl.
Good morning.
Then online, we say hello to Philippe Montaigne. Hello, Philippe, good morning.
Hello, good morning, everybody.
Hello, good morning. You are partnered at Fund Plus, a venture capital fund in Belgium. Good morning. Then in the middle of the stage, we have Hakam Goker. He's Vice President of M Ventures from Netherlands. Good morning, Hakam. And on my left, we have Valerie. She is CEO and founder of Ona Therapeutics. Good morning, Valerie.
Good morning.
May I just start with you, Valerie? Could you shortly introduce your company and your role in your company?
Sure. So I'm CEO and co-founder of Ona Therapeutics. And I started the company in 2019 together with Salvador Aznar-Benita. And our company is focused on trying to treat advanced cancer. So we are a company developing biologics to make a difference in cancer patients' life. That's what we do.
Great. We'll have a chance to talk about your company later on, because you had a very successful round last year. Now, Hakam, if you could please introduce your company.
Thank you. So I'm part of M Ventures. We're the corporate venture arm of KJA, investing in strategic areas of the company for the mid to long-term growth. We run a 450 million euro allocation that is split into 2 large groups, biotech and tech. I lead the biotech team with a colleague of mine leading the tech team, and under biotech, we cover healthcare, which here may be more meaningful to say drug development, and then life sciences, which is technologies enabling advances that are in the Sigma Millipore businesses of Merck.
Great.
Thank you.
So we have an international venture capital fund, plus a very well-known Spanish venture capital. Raúl, could you please introduce yourself and your company?
Yeah, I'm Raúl Martín Ruiz. I'm partnered with Isios. As you said, Isios Capital is the largest life sciences venture capital firm in Spain. We started operations in 2008, and we are now investing with our fund number 3. It's a 216 million euro fund. The idea is to invest in disruptive therapeutics across different therapeutic areas and modalities. And that's what we do, co-invest with other specialized investors from Europe, the US, and we typically invest in Europe and the US.
Great, thank you, Raúl. And finally, Philippe, nice to see you. Could you please introduce yourself and your company?
Yes, I'm a partner with Fund Plus. So Fund Plus is a relatively new fund created only 6 years ago and based in Belgium. We are an evergreen fund with a societal impact. At least that's what we want to do. It's a 220 million euros fund with 16 portfolio companies in management. And basically, we are focusing on biotech area. We are focusing on Europe with specific hubs. Of course, Belgium, because it's a very attractive hub, but also Spain became of interest to us. We'll come back to that, of course. And we are also investing in France, Germany, and a few other European countries.
Thank you. Great. Thank you very much, Philippe. And thank you to all of you. So we have 3 venture capital funds foreign ones from Belgium and the Netherlands, and Spanish one, plus a national Spanish company based in Barcelona, Ona Therapeutics. Now, I would like to start this conversation talking, how could it not be so, about the pandemic. Now, we were just chatting about this. This has been very, very challenging times for investors, probably for companies too. So what was the main challenge and the main thing we have learned over this period? Raúl, may I start with you?
Okay, sure. Well, first of all, before entering into the challenges, I think that, on the positive side, what I think is that the pandemic has served to a positive purpose. Now the general population, and not only the specialized investors and the pharma companies and all the biotech sector, the general population knows how relevant it is to invest in biotechnology, right? And how relevant it is to invest in human health. So I think that that's probably the only one, right? The only positive outcome of this pandemic that we had. Then in terms of challenges, well, I mean, life goes on, right? So during the pandemic, we had to continue doing our job. We had to continue having board meetings with our portfolio companies. We had to continue doing due diligences of those opportunities that we were considering to invest in. And at the beginning, of course, we were really scared because we had to take investment decisions in some cases without having met the management teams in person, and especially in their premises. That's something that we always try to do with our investments. It's something that we couldn't do, right? So we had to develop some skills that we didn't have and try to, to see the interaction of the people and to be convinced that we were investing in a good team just on the screen, right?
I guess, Philippe, now that you're online, that was also main challenge for you, not meeting the people, not having this possibility to see the faces of your companies. Was that the case?
Yeah, that's right. And another challenge is the sound. I have some echo, so let me see if I can fix that. So yeah, indeed. So it's a different way of working. So by chance, we know many people. Like today, I know two of my colleagues here on the round table, which is certainly helping. But indeed, as Raúl said, it's a different way of working. We haven't worked less. I think we have even worked more as VC. It has been extremely active, extremely intense. On the financial side, we had huge opportunities and the money was available to invest. We can talk about some examples, like we did an IPO on the Nasdaq last year in the middle of the COVID situation, which was being very successful with Iteos Therapeutics. So not less work, but even more. But of course, some portfolio companies have been impacted with some impact on the clinical studies when these were not prioritized in the hospitals where they were operating. Preclinical work has been impacted sometimes. And then there is another direct impact is the creation of companies dedicated to the COVID situation. And as you may know, at Fund Plus, we have taken the lead and created Exevir Bio, a company based in Belgium, which is developing a llama nanobody against COVID-19, so a therapeutic monoclonal antibody, which is now in clinical stage, phase 1A and phase 1B, after 1 year. So this is a very challenging project as well, but extremely exciting. And the COVID projects are a way to actually see what should happen in 3 or 4 years of a biotech company, of the life of a biotech company in only 1 year. That's what we have done, and that's what everybody has done in COVID. Those who are working on the COVID are condensing these days. So it's an accelerated way of living the normal life of a biotech company. But we can come back to that if you want.
Exactly. You mentioned the availability of funds, the liquidity. Håkan, I think the pandemic has brought the attraction to your sector and to many others, but to health in general. Did you feel that interest? Do you have more funds interested in investment? Do you have more, you see this change of mentality with regard to bio and health in general?
It's been actually quite interesting that I guess what we lived through the pandemic, I have not lived anything like that before in my lifetime. So it's a bit like a war, I guess, right, in some ways. So one's thinking and focus areas shift, and I think that applies also for many of the investors out there. So maybe the disclaimer is that we had a lot of generalist capital coming into the sector, which was applied on the public markets, that will gradually disappear as other businesses open up. But we expect that quite a bit of that will still remain in healthcare and biotech. On the private side, many venture funds have closed their new funds. There is a lot of money available. Corporate funds are continuing. In fact, some of them have increased their allocations for investing in biotech. So we have seen, although we don't have a control experiment with the right line, we have seen more money coming into the sector. I mean, from our side, we have completed more than 6 investments during the COVID time, and for an early stage company creation setup that we have, it's quite challenging. As Raul mentioned, meeting teams is your #1 priority, but it was not possible. So it took longer, but it was doable. So a lot of money was deployed, and we got used to working remotely.
Yeah, exactly. Valérie, you were exactly one of those companies that raised funds in the middle of the pandemics. We were just listening in the previous panel from a fund investing in you, in your company. Now, how was this experience? How much a challenge was that to raise that money in the middle of the pandemic? And what has it brought to you?
Yeah, it was a challenge, but on the other hand, we were somehow lucky with the timing. So as you know, ONA was funded in 2019, and our first investor was Asabi's partner. So Clara Campas, who was in the previous panel, was instrumental of helping us setting up ONA. And then we spent a year fundraising. So as you all know, it takes a while to see it around. So you have to start way at advance. So actually, after signing the seed funding, 1 second I thought, oh, now I can relax a bit, and it's not true. The next day you have to go raise the next one. So we were actually super lucky because we got a term sheet a week before the full lockdown. So we got a term sheet. We were very lucky to have then an international syndicate. So Isios invested 10 in us together with Philippe from Fund Plus. We also have Alta, and we also have BPI France. So we got a term sheet a week before the lockdown. And then I thought, oh, thank God, but it's still only a term sheet. We still have to negotiate more. And I thought that was going to be really hard during the pandemic. But there's one more advantage. So I agree, Raul, there's only one advantage of the pandemic, that healthcare became important. A second thing was investors don't travel. So it's a lot easier to get them online and to discuss a contract. So that helped. So yeah, the negotiations went a bit easier because everybody was more available and people worked late nights and weekends because there was no balance anymore between working and not. And yeah, so that was lucky. Company-wise, it was a bit more tricky, of course. We are lucky that we're not yet in clinical stages. So there are other companies like, for example, Sanifit and Minorix who had a bigger challenge because they were in clinical trials. And like Philippe said, it's harder to do that. For us, the main thing was we had to be creative. We had to do our preclinical studies. We had to set up different CRO structures and work in shifts in the lab. But we, as a small biotech, you're used to be flexible. So at the end of the day, it went quite well.
Great, thank you. I think we have covered a little bit the effects of the pandemic. Now, let's talk about the Spanish ecosystem, if I may so. We've heard a lot about the excellent research and health system in Spain. We know the challenge of funding small companies. We have 2 international venture capital funds with us today. So I'd like to start with you, Håkan and Philippe, to what attracted you from Spain, from investing in Spain? What's the difference you may see when comparing it with other possible companies in your portfolio?
Absolutely. We currently don't have an active investee company in Spain. We're working at it with the quite successful technology transfer offices, actually, of the universities. As you know, Spain has produced a lot of key opinion leaders that are spread around the world, and they do have their links back to the country and the universities they came out of. So we try to maximize on that to help them build their next big thing. There are, of course, certain areas where Spain is important for us also from the mother company perspective. For example, Merck is the leader in IVF and fertility, where Spain is one of the most advanced customers that are also very innovative in the field. But I'll leave that aside. So what really attracts us here is that there are a number of pharma companies in Spain that have grown and produced entrepreneurs. There are good academic institutions that are world-class that produce the necessary innovation that can be put towards creating new companies. So that is the attraction for us.
Yeah. In your case, Philippe, may I ask you, what raised your interest for Spain?
Well, initially we have been attracted mainly by the science, of course, and not only the science, but also what I call the concept of a hub. And you have some hubs in Spain, especially the one I know best is in Barcelona, of course, but we don't want to be limited to Barcelona in future. But definitely there is a hub there that we start knowing really well, with excellent science, room for investors. It is still a relatively open territory to international investors, and of course there are strong local investors. We have Raúl representing one of these, the largest one actually, but there is some room for international investors. There is some very good open mindset locally, and I see that more and more, people being open to being internationalized, and it's not by chance that we have a non-Spanish CEO here representing one of the best funded Spanish biotech companies with Valérie. So definitely there is this open mindset. It does exist. It's becoming more international. And that's how fun. Plus, actually, I attended my first Biospain, I think was in 2018, when I could announce that we were taking the lead on Minorix fundraising, which was the largest fundraising that year in a biotech company in Spain in 2018. And indeed, last year with ONA, we were part of the fundraising, which was the largest ever at that early stage for a biotech company in Spain. So we definitely want to help translate this local excellence in real innovation, really translate that. But, well, we can come to the challenge later, I suppose. You will also ask us about that. I'm sure, Alberto, there are still some challenges to make Spain and the Spanish environment even more open to international, and to continue to attract international investors. But certainly we are very happy to be amongst the first ones to make these changes over the last years.
Yeah, certainly, Philippe. That's one of the main topics we should raise today. I mean, and we have experts here, so let's ask them. Raúl, what's your view? What are the challenges for this vibrant ecosystem? What are their fragilities?
Yeah.
How do you see it evolving?
Again, I would like to start with a positive thing. As I said before, our first investment was in 2017, right? At that time, there were no Spanish biotech companies that had been funded by specialized VCs from outside of Spain. And if we look at the picture now, in 2021, we have, at least ourselves, we have invested in 13 companies, well, 12, but we include one because the science of that company, even though it's in France, it comes precisely from here, from Pamplona. So we say 13. And those 13 companies, they have raised more than 450 million euros. And for every euro that we have invested in those companies, they have raised, I think it's like 3.7 euros from international VCs. So this is something that, if you look back to 2007, 2008, I mean, that was completely unforeseeable, right? So that's the positive message. I mean, I think that now Spain is in the map. We have a number of international investors that have already invested here. We have others that are continuously looking at opportunities, and they are asking us, and we are trying to work together with them. So I think this is the good message, right? Then in terms of challenges, I mean, we're still small. If you compare Spain in the biotech sector with with other countries such as the UK, Germany, Denmark even. It's a small country but has a lot of activity. France, we're still small, but as it was mentioned before, we have the the basis for making this bigger, right? We have great research centers, we have KOLs, as Hakan said, spread all over the world, but also here. We have now an entrepreneurial spirit that is becoming more popular, and we start to have some success stories. We had a couple of companies, Celerix and Diagnostica, that we invested in those companies, and they completed the cycle. They were funded, they generated value, and they were acquired by larger corporations, and the companies are still operating, and the programs are active, right? So I think that we need more cases like those, but we are working in the right direction. But we have to work a little bit more.
Yeah, I fully agree with you, Raúl, about the importance of specialized venture capitals. I mean, sectoral venture capitals. In Spain, we have something like 200, 210 venture capital funds or companies. But few of them are specialized in the sector. You're one of them, and that's when we talk to foreign investors that are not specialized. What they want to talk is to specialized foreign venture capitals that can lead you to the sector. They can talk about food tech or biotech or whatever, but from the expert view. So I fully agree with you. Another challenge is probably the size. You mentioned it. I mean. Now, how do you see yourself evolving, Ona, in the next few years? Valérie, what's your ambition? Where do you want to be in 5, 10 years?
When I want
in terms of investment, I mean, it's a big question, but...
Yes, well, as Raúl was saying, I think, first of all, and also as Philippe was saying, so I am not originally from Spain, but I feel Spanish. I think the Spanish ecosystem, the biotech system adopted me. And I think funds like ICIOS, they were instrumental to put Spain on the map. Because when I left Belgium, they asked me, what are you going to do in Spain? Is there biotech? And I also said, I don't know. But when I arrived here, I realized there is really huge possibilities and specialized funds. So if you have a syndicate like ONA has, it really helps. So we are properly funded. We can be international. We can move forward fast. We can use the best KOLs. We have the best CROs, so we can really play internationally. So where do I see ONA in 5 years? Well, I hope in a clinical proof of concept. I hope even a bit earlier than that. So at ONA, we are hopefully selecting our clinical candidate by the end of the year and start IND-enabling studies and move forward and build a company. We at the moment already hired some CSO. We have an independent chair at the moment. So we're growing and growing, and that's the idea. Move forward and make a difference in patients' life. And also transform the capital into value. That's the goal.
Great. Was it a challenge for you and the investment round, the formation of a management team? Was it already established before the round? How did the raising of funds change the management? Was that a real challenge for you?
Well, I started the company and I was employee 1, and I was employee 1 for a long time, for a year. And of course, you hire a few people, but then if you get a round of this size, people are more attracted to come because they know they have a future. You have cash runway for a while, so you can attract better people. But my team is international, but I also want to highlight that a big part of my team are local Spanish people, and they are great. And I think sometimes it's inherent in the Spanish culture that people are actually a bit shy. You would not think, before in Belgium, I thought that Spanish people were very open, but it's not. In biotech, a lot of people are shy and they sometimes underestimate themselves. And my team, for example, my COO, my director of research, a lot of my scientists are top-notch. They are really excellent scientists and really excellent professionals, and they can compete with other teams. But then for the C-suite position, of course, it helped. So now we have an international C-suite position. It helped if you're properly funded and you're moving in the right direction. And also you have the network, because with the syndicate, we have, I call it smart money. The syndicate, like ICIOS and Fund Plus, they are not only investing money, but they are investing their network, and they help us attract the right people. So that's very useful.
In your case, Hakan, I mean, I believe there are many students, small biotech companies listen to us today. What's your experience about formation of management teams? What do you look at when you want to invest in a company?
I guess it's two-pronged, right? I mean, we talked about, what makes a good venture-backed space and geography. And it's kind of a couple of things: finance, people, and then the core innovation that comes out. And Spain has all three. You can probably do, if you lift one, the other one comes up. It's a kind of a, it's a kind of a jack of all trades situation. So, with those, you can make it a lot easier to also attract people as the hubs are growing, as Spanish pharma is growing, producing more entrepreneurs, and as funds are growing, venture funds are growing, and universities keep producing technology. So it's a bit of a kind of three-card game, and management, of course, falls under that. And for early companies, I mean, we're not fast on, are you a repeat entrepreneur? Are you coming out of a university? So long as you, especially for the less experienced entrepreneurs that come out of academia, we do quite a lot of hand-holding, and we bring in our network to help out. So long as the thinking of growth and teamwork and knowing what you don't know is pretty important at early stages. So, with that, we, and I'm sure, our peers, we work with Isios quite a lot, we work with Fund Plus quite a lot. At this stage of investments, we're all pretty much aligned that we're hands-on to build that. So if I were to give an example, I mean, we talk quite a lot with Ona. Unfortunately, we didn't get there. And
Yet.
Yes, exactly. There's always a time. So we're having a meeting later. But in opportunities that we look at in Spain, the first people that we call are Isios, other Spanish venture funds, because for us it's very important to have people on the ground that are actually very close to the management teams to get what you don't see on a written piece of paper, if that makes sense.
Yeah, exactly. And Raúl, you have a long experience in investing in companies in Spain, and you probably can talk a lot of things about management teams. What is your experience?
Yeah, I can say a few things. So it's true that, I mean, as I said before, we don't have a highly developed ecosystem with people that have been in the business, in the biotech business for years. But we have some pharma companies, some of them, not many, but a few, doing their own R&D. They have very good people, very professional. Some of these people are now available, and they've jumped into the biotech arena, and they have they have started companies or they have joined companies, bringing their pharma R&D expertise. And we have another example that is very interesting. As I mentioned before, one of the companies that completed the full cycle was Diagnostica. Diagnostica was acquired back in 2018, and then I think it was like 1 year and a half after that, the two founders set up another company, right? That company, of course, was funded pretty easily because they had the experience of dealing with international investors, and they had the experience of dealing with all the challenges that imply to set up a new company and to develop their product, right? So we need more cases like those, because if these people want to become entrepreneurs twice or serial entrepreneurs, I think that will be extremely helpful. And then what we have seen is that there are, I mean, it's relatively easy to get international CEOs for companies if they are well funded. It's like what Valerie said, right? If the company is well funded, it's easier. We would like to, and not only when they are well funded, but also when they are at a later stage, right? In a more advanced stage, not early stage. So we would like to try to work and bring international CEOs to early stage companies. We think that this is a global business. We all know that. And it's very important to have, multicultural teams and people with different experiences in different countries. So that's something that we would like to do. And then there are other options to bring a good management team, and creative ones, like one of our portfolio companies, Sunnyfit, that they had to hire a CMO, a Chief Medical Officer, and they found the right person in San Diego. And that person had been working in a previous company, and he could join Sanifit with his previous team, so the whole clinical team. That's what the company needed. But those guys were in San Diego, and then Sanifit ended up setting up an affiliate in San Diego, and the clinical team is working from there, and it's working pretty well, right? So you have to be creative sometimes as well with management.
Yeah. Is that your experience, Philippe? Creating?
Yeah, no, absolutely. And I think what is critical for Spain is to work a little bit more on the culture. That's why I was talking about an open mindset and being open to internationalization, being open to translation from the academic science to biotech and to pharma. And so I think the best way to deal with these questions or this difficult question of culture comes with exchanges between the world of the academic world, the world of biotechs, and the world of pharma in all directions. Actually, you can have exchanges from ex-pharma people coaching people in the biotech companies or being members, independent members on the boards. You can have people from the academic world, even KOLs, being more involved in the life of biotech companies. So it goes in all directions between academic world, biotech world, and the pharma world. And then it's very important to have the exchanges on at the international level, bring non-Spanish people on Spanish boards and management companies, and also management of the companies, and the other way around, and also export some good Spanish entrepreneurs so that they come back with that spirit. So I think working on this culture with all these exchanges is critical to me.
Yeah, exactly. Thank you. Well, let me now raise another issue to all of you. Now, Spain has relatively few large pharma companies compared to other major pharma powerhouses in Europe, for instance. This clearly influences your activity. I would like to talk about it. I remember last year talking 1 year ago exactly with Acebio about this challenge of the relationship between the pharma industry and the biotech innovation. Now, how do you see it, Raul?
Yeah, I mean, as I said before, there are pharmas in Spain. Some of them have R&D, but there are not so many. And, all of them are focused on something, right? On a specific therapeutic area or conditions, right? Then that makes difficult for them to collaborate with biotechs unless they are in the same field. But of course, if they find a match, I think that they should consider a collaboration, assuming that, of course, the company is a good company, right? But if you have something close to you, why not explore it, right? So that's one thing. And the other thing that the pharma companies could do, in at least the Spanish ones, is to create corporate venture funds. Those corporate venture funds, we have Hagan here. They might be independent from the companies. They might be strategic. They might be financially driven. But in any case, I think it might be very helpful for the ecosystem that these pharma companies could have these corporate venture funds, and they could invest together with us and together with other international investors in companies that are created in Spain, coming from research centers or even in existing companies.
Yeah. What is your experience? How come you represent M-Venture, representing a big pharma company, and how do you see open innovation coming from such a large company? To what extent should you be open to any kind of innovation happening in the world, or do you only see innovations that fit in your company? I mean,
so let me think what words I can use here. So we're strategic. So what does strategy mean? Strategy is not a today issue. So what we have always agreed with our organization that has been very generous in our cash allocation and our investments. We have more than 60 investments since 2009. We have been around for a very long time. So our understanding is that we will be addressing mid to long-term strategy. Now, every organization has a mid to long-term strategy, but we also know that there are so many wriggles all the way to the mid to long term. So I think the core of it is I agree with Raul. It is a beneficial tool for organizations to have a corporate venture fund that behaves like institutional funds, because otherwise these guys would not let us into the deals, and we would be struggling to attract them into our deals. But this essentially opens a whole new window for large organizations to innovation at the ground through the corporate venture capital fund. So that would help. When we look at innovation, because we're strategic, we look at the core areas, but also adjacent areas, kind of keeping an open mind of what if our organization kind of goes left or right in that strategy. So it's a bit like a calculated crystal ball, if I may say. And to be able to be a successful corporate venture fund, and successful, I put it into inverted commas, because as Raul explained, some of us say financial gain, some of us say strategic gain, we say both. From a venture side, you need to have very close working relationships with your research organization, with your strategy organization above, so that you're involved in, where is that strategy going, and how can I address that from using the private equity venture tool to really see, what can we build in this space? And out of those, your organization will hopefully take out one or two companies, establish good collaborations, and the others, you of course return for financial return, and then continue your evergreen structure.
Yeah, that's quite a challenge to mix
But it
those
works.
roles.
It works. I mean, one recent example is a company that we have helped create called Artios Pharma with SV in London in the novel DNA damage repair space. Companies based in Cambridge, UK. We recruited the team. This was a core area for Merck Oncology. So we went ahead with the investment. We syndicated with corporate venture funds, other venture funds. Company raised their oversubscribed Series B. Then raised recently quite a large crossover round with a number of key US investors. As Raul said, we opened an office in the US to put some of our management team there. And then at the start of this year, Merck Oncology announced a significant deal with them on a number of programs that have been in their pipeline. And shortly after, one of our other co-investor colleagues from, so we have Novartis Venture Fund, Novartis announced another collaboration with Artios. So it does work, but you have to be very disciplined about how you get there.
Thank you. Okay, we are closely coming to an end, so I would like to raise one last topic for this debate, this panel, which is early stage financing. I believe we have a lot of small companies watching us today, and I think it's important for them to learn from experts. And I would like to ask you if you may have a secret tip for these companies that are listening to us. What should they do when talking to investors? What is your experience, Valerie?
It's a difficult one. Well, I think listen to them. I think it's very useful that you listen, and you not only speak, but that you listen and that you have an open relationship. I think it's also really important to be able to say, I don't know, but I'm going to find that out. Because, like Hakam said, it's really important to know what you don't know and to work on that together with the VCs. So I think that have a good team, be open, have lots of energy, and I think that's the only advice I can give. And say sometimes I don't know.
And what's your experience, Philip, when talking to very, very small companies, promising ones, but small?
Yeah, actually, it's a good question for us at Fund Plus, because when we started in 2015, we decided that we would invest essentially at the level of Series A, Series B. we were not looking to do any seed investment, and that's because we thought that we brought more expertise at the level of a Series A, probably late clinical or early clinical stage, but also because we wanted to make sure that we could contribute to something that would be properly funded. And then progressively, we have done earlier stage investments, like ONA is, of course, a typical example. But ONA shows well what we try to do when we are investing at an earlier stage. We want it to be within a large syndicate and with a strong fundraising, so that we are not going for a new fundraising the year after or 2 years after. We want to make sure that, and of course it's tranched, it's with milestones, so it can start even with a first tranche that would correspond to an initial seed investment. But for us, what is very, very important if we start at an early stage is to be in a strong syndicate with a good fundraising that goes beyond the first step and goes to an interesting valuation inflection point. ONA is a good example. We have a few other examples in our portfolio. This is critical for us, and I believe it's a trend. I would be interested to hear from Raoul and Hakan what they think, but I observe that as a trend, that we invest more and more at an earlier stage to go a bit longer, again with milestones and tranches, but to secure a longer and more comfortable investment for the life of the company as well.
Hakan or Raoul?
Yeah, I think it makes complete sense. I mean, it's good for the investors because you secure a syndicate, assuming that things go well. Of course, you will have to tranche the investment, as Philippe said. You will have to link the tranches to significant milestones that mitigate the risk and increase the value. But you know that the money is already there, committed, assuming that things go well. And that's, that somehow relieves you. And I think it relieves a lot to the company as well, because they know that if things go well, they don't have to spend a significant amount of time every year fundraising, right? And Valerie said that it took 1 year.
Yes.
1 year to raise the round. I mean, you cannot afford that every 2 years or every year. You cannot do that. So I think it makes complete sense to raise this type of large Series A that include a seed component at the beginning, but that they can allow the company to get to meaningful data that eventually could even trigger an exit, right? Trigger the interest from a pharmaceutical company.
Yeah. It's a very good point Raoul makes, and it's a challenge because institutional investors have a kind of a guillotine hanging at 10 years, right? You can push, get it to 12 years fund life. We have a longer patience, but in an ideal world, we would like to work together to bring different aspects of expertise into the same management team, right? So it's a challenge. Some institutionals are managing to convince their LPs that they will have a seed portion, which they can write off and start their investment time from then on, which has been proven to be quite beneficial. Some haven't. But in early stage ones that we have done, Artios was an early stage company, but it was an institutional behind it with us that seeded it. We had the mixture of evergreen and not. Storm Therapeutics was another one. So nearly in all our companies, we have started very early on. And yes, it's scary for venture funds, institutional venture funds, to say, okay, well, am I going to actually get my money? 10 years is the guillotine, but actually small guillotines start falling from year 5 onwards. So you need to show that you're performing to the people who give you the money, right? So it depends on also, the LPs, if it's your current LPs or new ones where you can actually get a broader sense of longer timelines, that'll help them. But when we go in, we do find ourselves as a bunch of corporate venture funds in early stages, and then institutionals come in later. And we do try to do always at least 3 to 4 arm deals. So 4 investors, same company, everyone knows what the risks are. People don't run home throwing the baby out with the bathwater, and then get that company to move on to a real data point which attracts larger investors, because otherwise you have management teams running around like chickens, trying to get 1 penny here, 2 pennies there, to actually get to a stage. So are they focusing on the work that they're meant to be doing, or are they literally, you know, buying new shoes because they keep going off from going around to so many investor places? So that's the challenge. And it is getting a lot better, but we would like to actually see that more of our institutional peers actually join that early stage, because the experience they bring in is complementary to what we bring in as well.
Thank you. I think we have come to an end. That was a very interesting point at the very end, the early stage debate. I think we have some tips, maybe not secret, but nice recommendations. Some humility when talking to us, I don't know that, but let me find out. This showing performance, I like that idea. You need to show your performance. At the same time, you need to choose your partners, so that you don't have to run like a chicken every year going for funds. Those 3 things I believe are very useful to our audience. I thank you very much, Philippe, Valérie, Håkan, Raúl, for your very nice words. I wish you all a very successful Biospain. Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you very much. Alberto has made a perfect resume of this panel, in which I have to thank especially to Isios Capital, who have made it possible. Well, we make the change with the next panel, thank you, of course, and we continue learning about this biotech business, and now we can, we make the change. Yeah, thank you.